My name is Jim Hyman, and I'm the AVP of Northwell Health's HIE. I'm very happy to speak to you today about our journey partnering with InterSystems and their technology suite to support our strategic vision and growth as a leader in healthcare delivery in our region. Northwell is located in the Northeast United States and is New York's largest private employer with 23 hospitals, over 800 practices, acquiring additional practices on a weekly basis. 76,000 employees, and every type of healthcare service, making it a large independent delivery network for the 14 million patient community we serve in innovative ways. Over the last 20 years, Northwell emerged to this stature through growth and acquisitions, leaving a siloed and disparate technology landscape. In the modern age of access to data and open sharing of information, Northwell's HIE platform emerged to facilitate improvements of care delivery and coordination through interoperability and accessibility to data. In addition to bringing together the data, the platform enables the structural and semantic normalization of records, particularly enabling some innovative work around patient identity on InterSystems Patient Index, creating a truly connected experience through an aggregated, actionable, comprehensive care record. Taking the lens of technology's role, there's a big buzz around digital transformation. I view transformation as an outcome, not necessarily as the path. I'd like to focus more on the concept of enablement. Many would suggest, and I agree, that we have been on this journey for some time now, but the rest of our organizations are now ready to embrace the road ahead. A solid digital platform is the cornerstone foundation to an enabled organization. The platform needs to have the technology building blocks to implement solutions that accommodate the scale and flexibility of the organization's future and evolving mission. Each of these technology layers within the platform have their own architectural roadmap and set of strategies that accommodate both the emergent technology advancements and the solution needs of the organization. In essence, the platform creation never really has an end, as it will have a life of its own in support of where the organizational strategies continue to evolve. While we have already experienced successes on our journey, we are constantly advancing each layer of the platform to become an ideal enabled organization. I'll point out a few of the opportunities about each layer. While we have a full API management technology backbone, the beginning of each process in use today are not completely self-service. At the data layer, we run separate platforms for real-time streaming use cases and analytics use cases. We're getting closer to a path to curate and use data together along these hot and cold paths. At an intelligence layer, while we have pockets of data scientists training AI algorithms, we are on a journey to truly democratize the intelligence development capabilities within a comprehensive modeling and runtime environment with the broad education of our staff required to meet our long-term goals for our organization. From an RPA standpoint, we've implemented about a dozen use cases and only scratching the surface of what's truly possible, learning a lot around each corner. Why are we thinking this way? If we do this well, what are some of the outcomes and solutions we would hope to achieve? In general, like most organizations, we are focusing in a few different areas. I have included a sampling here. Looking at truly reimagining the customer experience through access to data, a truly we know you experience at each subsequent care venue, intelligently incorporating a patient's wishes and device data into their medical care, and also redefining the ways by which care is experienced in our communities. For a clinician or systems user, adding broader intelligence layers into the care delivery process and not just focused on billing and medical errors. Improved peer-to-peer collaboration opportunities, mainly by lowering the barriers to connecting to another provider. Ultimately, better clinician experiences done correctly will result in a better patient experience. From an organization's perspective, leveraging the full data ecosystem in new and creative ways to improve patient throughput, continue to scale automation, reducing redundant and not unnecessary human interventions. We also have opportunities to streamline onboarding of new acquisitions into the broader platform, for optimized continued expansion and fostering the broader patient and client experiences. On an innovation front, the platform backbone enables us as an even more attractive co-development partner to collaborate on new ideas where the starting point gets right into the meat of the opportunity as opposed to costly on-ramps previously discussed. I hope you found Northwell's journey to be enticing and thought-provoking. With the right partners, an enabled technology platform, and great people, anything is possible, even in the throes of a pandemic, and setting the stage for creating your future. Thank you.